fellow Namibians, the situation in the country remains complex and it is evolving. To date, Namibia has recorded a total number of 9,437 confirmed cases. 4,898 of these have recovered and 4,441 remain active. We deeply regret the loss of 98 Namibian lives to COVID-related illnesses, of whom 2 were health workers from Windhoek and Geingob. The greatest expression of our humanity is found in service to others. We therefore honor and thank our frontline workers for their loyalty, bravery, and willingness to place their own lives at risk on a daily basis in order to preserve others' lives. May the souls of the departed rest in eternal peace. Since the highest reported incident of daily new cases, that of 316 on 23rd August 2020, the number of daily confirmed cases has been declining. From 29th August to date, the number of reported new daily cases has declined from an average of 227 to 181 cases per day. This represents a 20% reduction in the average number of new cases reported daily countrywide. Geographically, we recorded during the same period the following reductions in the confirmed number of new infections. Erongo region by 50%, Khomas region 24%, Omusati region 38%, and Oshana region 32%. This suggests a slowing rate of transmission, which could be attributable to the measures introduced, such as the country-wide curfew. However, these signs are still in the early days, and Namibia is still relatively early into the epidemic. As far as the establishment of community transformation and other parts of the country are concerned. The number of new cases will continue to fluctuate because these numbers are influenced by a range of factors, including the national testing and tracing capacity, public compliance, and possibility of an upsurge in other parts of the country. The epidemic remains dynamic. Namibians must therefore continue to be vigilant in order to break the chain of transmission. Regions which previously recorded lower cases are now recording rising rates of infection. This is a matter of concern. The new cases increased in the Kavango East region by 138%, 38% in Ochiranjuba region, 69% in Karas region, and by 40% in Hardap region. While the majority of the people do not become very ill from COVID-19, others with pre-existing conditions can become gravely ill. In this regard, our hospitals are reporting high patient volumes of COVID-19 related admissions. The government is therefore increasing the capacities for testing as well as hospital-based isolation across the country. In so doing, we will effectively identify, trace, manage, and treat COVID-19 patients while we simultaneously suppress the spread of the virus. While increasing testing capacity has been challenging, our laboratories are working tirelessly to meet the increasing demand. In the same vein, I appreciate and commend our laboratory workers for their diligent work in providing this crucial service in our national response to this pandemic. Fellow Namibians, the current moderate precautionary measures under Stage 3 of the state of the emergency, which are set to lapse at midnight on Sunday, will be extended to all 14 regions of the country for an additional 5 days. The following measures will apply to all 14 regions from Sunday, 13 September 2020 until midnight Thursday, 17 September 2020. 1. Travel restrictions into and out of the city of Windhoek, Okahanja, and Rehoboth local authority areas remain in force. 2. International travels. A. Travel out of Namibia will be permitted via Hosea Kutako International Airport, subject to quarantine at own cost upon return. B. Entry and exit into Namibia for business travel purposes will be permitted via Hosea Kutako International Airport. This is in addition to the Tourism Revival Initiative and subject to quarantine at own cost upon arrival and return. 3. The number of persons per public gathering is increased to a maximum of 50 countrywide. This includes social gatherings such as weddings, funerals, religious gatherings, etc. 4. To complement economic activities, the daily curfew hours will now commence from 22 to 5 a.m. countrywide. 22 for the old-timers is 10 o'clock, from 10 o'clock up to 5 a.m. in the morning. 5. The following business activities will be permitted to resume countrywide, including within the restricted areas of the city of Windhoek, Okahanja, and Rehoboth local authority. A. Restaurants, cafes, and informal food traders may reopen for sit-down meals and may sell alcohol for on-site consumption only. B. For shebeens, bars, and liquor outlets, trading hours for the sale of alcohol remain the same countrywide, and alcohol is only to be sold for off-site consumption. C. Entertainment events, conferences, and workshops may resume in compliance with the limit on public gatherings as well as health and hygienic protocols. D. Nightclubs and gambling houses are to remain closed for the duration of this period. Due to the curfew, these businesses may not be able to operate anyway. E. Contact sports will not be permitted to resume, considering challenges to comply with the public health measures. All non-contact sports, however, are permitted to continue, as has been the case. For those of you who may question why contact sports such as football are taking place in Europe, for example, please note that those sports are taking place within a bubble system, where players are completely isolated from their families and the rest of the public. Those are fully professional players, unlike ours. F. All businesses are expected to adhere to the guidelines stipulating the number of persons permitted inside an establishment per square meter. 6. I urge all members of the public to maintain strict hand hygiene and the wearing of masks at all times in public spaces. The public should apply discretion and maintain social distancing by staying home and avoiding large crowds, and maintain physical distancing by keeping a distance of 1.5 meters between persons. These basic measures are our first line of defense against an enemy that we cannot see.
President of the Republic of Namibia, Right Honorable Prime Minister, Honorable Deputy Prime Minister and Minister of International Relations and Cooperation, Honorable Ministers, media practitioners. On the 28th of August 2020, His Excellency the President announced COVID-19 response measures that will lapse tomorrow, the 12th of September 2020. We have just heard about the way forward in our national COVID-19 response for the period up to the 17th of September 2020, when the current state of emergency will lapse. At that occasion of the 28th of August 2020, I shared with the nation some information on several aspects of our national COVID-19 response. This includes safe burials for COVID-19 related deaths, post-human swabbing of human remains, autopsies, cremation, additional COVID-19 sample collection points, COVID-19 vaccines, and COVID-19 accountability report. Allow me, Your Excellency, to reiterate the government's position on some of these matters once again. On the matter of safe burials, we as the Ministry and other stakeholders wish to express our appreciation for the positive response and cooperation of the bereaved families and the society at large with respect to the conduct of safe burials. Yes, there were and continue to be areas of concern with regard to this matter, and we are working to ensure that these are ironed out in order to ensure that our departed citizens are afforded dignified burials, that the family have an opportunity to grieve their loved ones, accommodating their cultural and traditional practices, while at the same time ensuring that the imperatives of public health are not compromised in any way. As His Excellency has stated on many occasions, the health of the nation is paramount. Furthermore, it is our sincere commitment to ensure that no funeral should give rise to more funerals. On post-human swabbing of human remains, we reiterate once again that, given the fact that COVID-19 is a notifiable infectious disease in terms of our law, the handling of human remains of those who succumb to it or those remains that return positive results on the first post-humerus swabbing should be avoided. This is necessary for the protection of our frontline workers and the public at large. In the same context, we call on the families of the deceased to continue cooperating with the ministry officials on the matter of burials to avoid any delays so that the burials are carried out in compliance with the prescripts of public health imperatives, which the Ministry of Health and Social Services is obliged to enforce. The Ministry will continue to provide psychosocial support and engage with families to foster a positive spirit prior to and during the burial process so that families may find closures in the aftermath of the passing away of their relatives. I wish to announce that the Ministry of Health and Social Services and the City of Windhoek have successfully concluded negotiations in terms of which the city will avail facility to be utilized as additional COVID-19 sample collection points. The city will initially avail 2 points, namely Katutura and Ochomithe community centers. There is also a consideration to avail more facility in other parts of the city, such as Tobias Hanyeko in Hakahana, Ombili Municipal Hall, as well as sites Samora Machel and Moses Geingob constituencies. This will go a long way in improving our reach into the communities with these vital services. As such, residents will no longer have to travel long distances to access these services. The clinic at the Windhoek Central Correctional Facility has also been repurposed and is currently being utilized to collect COVID-19 specimens. Particularly, civil servants are encouraged to make use of this facility. As far as COVID-19 testing capacity in the country is concerned, I wish to report that additional capacity has been added in the form of a repurposed laboratory at the Central Veterinary Laboratory. In a true spirit of effectively utilizing public resources, the Central Veterinary Laboratory has provided its equipment, facilities, and personnel to contribute to this important national effort. I am further pleased to inform that the testing backlog for COVID-19 at Namibia Institute of Pathology, which stood at more than 4,000 2 weeks ago, has been reduced to less than 1,300. This means that we should be able to clear the backlog within the next few days. Thereafter, going forward, COVID-19 results will be released within a period of 24 hours. This is an important breakthrough in our response and preparedness. With respect to matters of quarantine and isolation, positive developments have been observed since the pivot of our policy measures to allow for home quarantine and home isolation where conditions allow. This has provided relief to those who chose and were able to effectively quarantine and isolate safely at home. As a result, we have seen a significant reduction in the number of persons quarantined and isolated in commercial facilities, such as hotels, guest houses, and lodges. This is a positive development from the perspective of cost saving by government. As we are moving towards the end of the state of emergency, the major responsibility for COVID-19 prevention and control is progressively shifting from government to individuals, families, and communities. It will be a sad day if the current gains of the past 6 months will be eroded by conducts that are not compatible with public health measures. As we will be on autopilot mode, we must ensure that we stay the course. I wish to echo our President's message that we must continue to hold hands, because only when we hold hands and pull together in the same direction, we'll be able to defeat COVID-19. I thank you, Excellency.